name is Barbara Myers, and I'm the host of Mental Health Matters. Today, our topic is the mental health of children. I'm very pleased to have today two guests who are experts in this area who are going to be talking to us about this topic. First, I'd like to introduce Julie Kurtz. Julie is the Director of Mental Health Services at Kidango. Welcome, Julie.
Thank you. It's nice to be here.
And next, I'd like to introduce Dr. Grace Manning Orenstein. She's the Executive Director of The Link to Children.
It's a pleasure to be here, Barbara.
Thank you. The organizations that Julie and Grace work for focus on mental health for children, very young children, from ages 0 through 5. I'd like to say that this topic has a special meaning for me. When my daughter was 8 years old, I was hospitalized for 3 weeks, and I had a very close relationship with my daughter before this. After I got out of the hospital, my daughter was in school. Her teacher reported to me that she was very fearful, and sometimes she was crying in class. So I took her to a therapist who specialized in handling children. And within 2 or 3 visits, she was back to normal. And so I'm a believer in early intervention because I think that fearfulness that she had might have become part of her way of being or her personality if we hadn't been able to take care of it so easily, so early. So I'm so pleased to be able to talk with Julie and Grace about this very important subject. So first what I'd like to do is have Julie tell us about your story, about why you're here and how you became involved in mental health for children and some about what you do.
My name is Julie Kurtz, and I'm the Mental Health Director at an agency called Kidango. Kidango has been around since 1974, and we have about 40 child care centers through San Francisco, Alameda County, and Santa Clara County. And we have several mental health programs as well. And those mental health programs, we have clinicians, mental health therapists or counselors that will go out to families' homes who have children who are 0 to 5 years old. They don't need to be a part of Kidango, and we will go into their home and help them with their children if they're having challenges in the home with their children and they don't know what might be going on. Mm-hmm. And we would go out to the school as well if the child is in school, mm-hmm. and work with the teachers who might also need some help.
Well, that's great.
Mm-hmm.
Can you tell us about a story of a child or a family that particularly sticks in your mind?
Yeah, Barbara, I worked with a family, and I went out to their home. They called me because they were having challenges with their child. And this particular family was having more challenges with their child at school. The teachers kicked the child out of preschool because the child was biting, hitting, kicking other children. When I went out to the home, this child, for this particular child, didn't really have a lot of challenges at home. And it happened to be the family was very structured and very loving with this child. And he did really well in a small environment, one-on-one. Mm-hmm. But as soon as he got in the classroom, he was overstimulated and overwhelmed. And I worked with this family to find a way to work and partner with the teachers in his new school to help him be successful. And it took some time. It took a lot of effort and observation about what worked. And together with the family and the teacher, we successfully helped this child who has been in this school for a year now and has been able to interact with other children in a positive way, engage in play, and not be overstimulated and develop some sense of self-control, and to work on some self-regulation skills. And so it's a really positive outcome. And that's just one example.
Oh, that's great. It must be very satisfying to see something like that happen.
There's so many kids out there with just a little linkage to some supports and help. We can help the parents. We can help the teachers.
I mean, it just sets them right for their whole life, you know, when they get a good start like that.
I can't tell you, and I'm sure Grace will be able to speak to that as well, that when you intervene early in a child's life, it makes the world of difference. But when we continue to allow the child to act out they begin to develop a bad and negative self-image. And then what happens is that snowballs year after year and builds on their sense of self. And sometimes it becomes harder and harder to change. The earlier intervene, the more hopeful it is for that child and the family.
Could you tell us a little bit about why you are personally committed on this issue, how you got interested and why you're personally committed to this issue?
I am very committed to this issue. We have about 17 staff members in our mental health department working in all different departments and programs, and I'm committed, and I know Grace is committed, and our colleagues that work in the field of helping children 0 to 5 and their families. We're all committed to one purpose, and that's reaching out to help families, teachers, and children become successful. And I know that the brain research from all the studies that have been done show that when you intervene early, it makes a difference in the life of a child. And I think sometimes parents feel stuck. They don't know what to do. I felt stuck with my own children. I have 2 children who are both wonderful, and I love them dearly. But I can't apply the same recipe to both of them. It's got to be looking at them in a unique way, and there have been times where I felt stuck and didn't know what to do. And I needed the help of an outside person, whether it be my husband or a teacher or a colleague who can help me look at things in a different way. Because I'm just doing what I know how to do, what I think is best. And sometimes we reach a point where we're stuck, whether it be the circumstances in our life. Maybe there's domestic violence going on in the home. Maybe there's a lot of chaos. Maybe there's a death in the family. Maybe the child has some developmental concerns that need to be assessed. And maybe there's a lot of arguing going on in the family, and that's causing the child stress. There could be multiple reasons for the child having problems, but it's important to get help for the child as well as the whole family. So I'm committed to letting people know out there that they're not alone, they can get help.
Grace, I'd like to hear from you about what you do in your job and how you got interested in this area, and maybe some stories of children.
Yes, I have a slightly different route to where I am today. I'm a Montessori teacher, and I had my own school for a number of years. And this was in the 70s and the early 80s when I recognized that child care was going to become a way that our nation cared for its children. That we were, with women going back in the workplace, we were really going to have to pay very careful attention to child care facilities in ways that we hadn't before. And there wasn't a lot of good child care there at the time, and I also recognized that teachers were really burdened with the kinds of problems that children were bringing into a social setting which was new for them, and also coming from settings that were chaotic and in many different ways, teachers not knowing how to handle these problems. So I actually went back to school and eventually got my PhD in clinical psychology combined with developmental psychology, and founded the Link to Children, TLC, so that we could train early childhood, that is interns in early childhood expertise. I now send them into the child care centers. Each of our centers has a play therapy room where they can perform play therapy with the children, helping them with self-regulation issues, aggression and fears. They can do parenting counseling with the parents right there at the center. The parents don't have to wait in line, at agencies, and they don't have to worry about transportation. And they can do a consultation with the teachers. This is a systemic approach to problems of early childhood. It's not really the child that has the problem so much as it's the environment in which the child's living. So we don't want to label or make the child wrong, but we want to give them a space in play therapy where they can really play out the depth of their emotions, get it off their mind. They're not that different from adults. Get the feelings out, and then have somebody there with them that can witness that and kind of redirect them.
I mentioned earlier that my daughter had therapy. She had play therapy. That's what they had her do, is to act out some of her feelings and her fears, and with someone that was there to watch and to help her get over it. And it was very successful.
Play therapy is very powerful for young children because usually when they are in trouble in the classroom or in their home environments, that is, just unable to regulate themselves and feeling sad and lonely or just very angry, there's a yearning for connection that they're not getting, and that play therapy hour once a week provides them with that. they can be themselves, fully themselves for 1 hour a week, and that's pretty remarkable for them, and it's very effective.
Now, how many centers do you have?
We're at 8 centers, 8 child
centers?
development centers, and we're also at the Alameda County Family Justice Center, which is a one-stop service center for women escaping domestic violence and their children. We provide domestic violence services.
So you're in the Berkeley, Oakland?
We're in Berkeley, Oakland, and Emeryville.
Okay.
Yeah.
All right. Good.
Yeah.
Very good. Can you tell us maybe a story about a child or a family that you work with?
Yes.
Okay.
I've been thinking about this. One of the things about our program is that we are multilingual, multicultural. We really have a staff that responds to the diversity of the children and families that we work with. 85% of the families that we work with are people of color. 76% of the teachers are people of color. Many multiple languages. In Lower San Antonio of Oakland, there's 27 languages spoken.
Wow.
So we have a huge diversity that we have to respond to. I'm remembering a little boy at an Asian child development center who was having a lot of trouble in the classroom. The teachers were calling him robotic, and he moved very little. He was non-communicative. And they were really thinking of referring him for services to have an evaluation for autism. And our intern, who was Chinese and spoke Cantonese, went into the classroom and met with this little boy just in the classroom and found out that actually his first language was Vietnamese. Oh. He was in a classroom that spoke Cantonese, and the teacher was white. Oh, so she found another teacher in the Asian community that was Vietnamese. Wow. And that connection allowed him to speak. She also found out that he had an uncle who was bringing him every day, so she was able to meet with the uncle. So she brought the child into play therapy. Play therapy doesn't need language. It needs eye contact, it needs feeling, it needs expression, it needs witnessing and understanding through that connection. So the play therapy took place anyway, and by the end of the year, the teachers saw a little child who had blossomed and actually could hold his own in the environment. And they had been ready to move him on and out of the program the year before. Now they were ready to have him stay on. Oh. That was a rather dramatic turnaround, and it was really a pleasure to hear.
I guess with all those different languages, it's surprising that we don't have any more situations like that.
Well, we do, unfortunately. There are multiple languages, but they're very hard to address. We just don't have. One of the things within our mental health community is that we don't have multiple languages in our field yet. I think it's going to be changing, but you would agree. I think we need particularly Latino, Spanish-speaking Latinos and Latinos, and we're finding more and more of those coming into our field, but we need all kinds, because it's important to be able to reach out to the community in which the child's living.
Oh, yeah. Well, you've already spoken a little bit about this. Alameda County is very diverse. And you talked about the challenges providing services for children in very diverse communities. And I wanted to know how you handle them. It's like in this one case, you were someone was able to tell that this child's language was not Cantonese. But I'm wondering in general, how do you approach that kind of situation?
With the diversity issue? Well, first of all, in our training, we train postmasters, mental health interns, and practicum psychology doctoral students at our center. That before they go to a center, they have to receive our training, our orientation, and then they are given training throughout their internship with us. And part of that training, not part of it, but our training is immersed in multilingualism, multiculturalism. We make sure that people at the table are diverse so they can have those discussions about cultural differences and acquire a cultural sensitivity that is very authentic to who they are as a clinician. So that's one of the first things we do. We do try to match interns with the centers where we can that are bilingual, so they get those services in a bilingual capacity as well.
So you have some of your people that work for you speak
different languages. We have 5 languages right now. We have Spanish speaking, American Sign Language, 2 Indian languages. That's 4. I can't remember the 5th one, but anyway, so Cantonese.
Cantonese.
Yeah.
Okay. If they notice that there's a child that has some other language, they have ways of getting resources from the general community, I would suppose.
Well, in our particular case, we would be focusing on mental health only. So maybe Julie has, can respond to that.
Okay.
Resources in the community.
Okay.
Okay. I wanted to add, in addition to the resources of the community, how Grace is absolutely right that the diversity is a very important piece. We want to serve all families, but it is scary to be a family out there, to have a problem with your child, and then to reach out for help. And it's even scarier to think about someone coming in your home and judging you. And just a simple example is when I was nursing my second child cried 24 hours a day for 8 months. And I had somebody come out to help me figure out why he wasn't latching on and why he wasn't nursing well. And she said to me, I don't know what's wrong with him. Why is he crying so much? And I thought, this person's supposed to be the expert. I must be a bad mom. And it is scary to have somebody come out to your home, and the fear of judging, the fear of being blamed, the fear that someone's going to say you did something wrong, and that just doesn't happen. And that is what the assumption is. And we go out to a family's home. When a family calls our agencies, we ask them, what do you need? What do you want? We can come out to your home and make it convenient for you. We can meet you at a local place, a park that's comfortable to you, a local restaurant, anywhere. And quite frankly, we will go wherever that family wants. But we're there to partner with the families and to make everything feel successful, not to blame anybody. That's a real scary piece.
I think we've really learned that to be the most help to families and children, we have to go to where they are. That, with the time factors involved, the busy lives that parents have, the real difficulties of transportation, make it almost impossible for families to get help in the regular traditional agencies. So we go to where the families are.
That's wonderful. I know I've heard, seen studies that show that sometimes families from other ethnicities, cultures that they're from, mental health is a larger stigma even than it is among.
Yes.
And how do you get over that?
You're right. Well, I think it's bigger than just that question. We are an immigrant nation, and in California, I think the white population or mainstream population is actually less than the minority population, or soon will be. So we are trained in the United States and in Europe in Western psychology, but Western psychology doesn't fit all cultures. So one of the things we really want to pay attention to are what remedies do specific cultures have to their own mental health. Culturally specific remedies to mental health issues. One big thing that's different is that they do not define their situation as mental health. It still has that feeling of being crazy, and they know that they're going through very difficult times under a lot of stress, and their coping is perhaps stretched to the limit, and they feel like they're losing it, but they're not crazy, and yet our Western psychology can make them feel that way. So that's the thing. We really work on that. We don't call ourselves mental health specialists. We call ourselves early interventionists. Other people call themselves developmental specialists. We really have to reframe and redefine what early intervention mental health is. Anything to add to that?
Well, I have just a story, which is about a dad. Actually, one of our child care centers called me because a child's mother died. And the child was having a tremendous amount of stress in the classroom and acting out, crying all the time. And what had happened, this father who's Samoan, everybody was coming home and mourning and crying and mourning the mother's death, but nobody talked to the child about it. Nobody told the child that a mom died. And the dad said to the child, he said, Mom, I'll be back. Don't worry. And finally the center asked for my advice, and I talked to them about asking the dad, tell me about why you're doing that, what you're doing, and why you want to do that. Maybe it was a part of his cultural belief. Maybe it was a part of his own belief about what the child needed. And he said, I don't know what to do. I do need some help. And I went and I met this father at a coffee shop. And I bought him a book to read to his child and some articles. And I just sat and listened to where he was coming from. No judgment at all. And I just said, tell me what you want for your child in this situation. And he broke down crying and he said, I don't want to tell my child because I don't want my child to feel the pain that I'm feeling. And as soon as that came out, he started talking about how would I talk to my child about that, because I hear that at the school it's really affecting my child not knowing. And we talked about it. We talked about the strategies. And that was only a one-time meeting to help him get over that hump. And the teachers report this child is doing so much better now. And it was just, sometimes we believe that children don't know what's going on. They don't see or hear. And that was a really critical change that father made, but it came from him, not from me telling him what to do.
I wish we all had days when we could feel like we affected the world in such a positive way. I would like to ask you both, what would you do if you had a friend or a family member who thinks their child might have a psychological problem? What would you tell them, or how would you tell them?
You want to go, Grace?
Okay. Well, again, our population is working with very young children, 0 to 5. But I think it's very important, first of all, that parents know that it's not their fault, that whatever's going on, the parent needs to be loved and appreciated for what they're going through. And I think Julie's bringing up the scare that parents frequently have that they will be judged is really key. So in working with a parent or meeting with a parent like that, your whole demeanor has to be one of acceptance and love for the parent in order to be of any good at all for the child. So that's the first thing. And then I would want the child, to have somebody observe that child. And everybody goes around about this slightly differently. But our approach is to assume that the smallest intervention will have the greatest effect. We don't jump into, huge diagnoses or, until we know more. And it frequently is that just 1 or 2 meetings are all that are required to get the child through. So eventually you do want the child assessed, and it might be a good idea to have the child see a therapist, but it also is really important for the parents to get the help as well.
Well, with my daughter, it was just 2 or 3 times, and there she was,
Yeah.
Now I'd like to move on to some resources and organizations that might be good for you who are watching. For those of you in Alameda County, there's a wonderful directory of early childhood mental health services that you can get on the internet for free. www.acgov.org/childcare/documents/earlychildhooddirectory.pdf. It's a comprehensive directory of mental health services for children in Alameda County. Next, I'd like to tell you about the way to find out about the 2 organizations of our guests. The Link to Children, which is Grace organization, their address on the web is www.thelinktochildren.org. And Kidango, Julie's organization, is www.kidango.org. There also is a hospital in Oakland called Children's Hospital Oakland, and that's at children'shospitaloakland.org, which has a very wide, comprehensive set of children's mental health services. For those of you who are not in Alameda County, there are a lot of good childhood and adolescent mental health care information on the website of the National Institute of Mental Health, www.nih.nih.gov. I'd like to leave you, who are watching, the audience, with a challenge. I'd like you to remember that children see, hear, and feel a lot more than they can say. We've heard some of their stories here. A little help can go a long way. If you know a parent whose child is having challenges and difficulties, I'd like for you to support them in understanding that this is not their fault, that they aren't alone, and that help is out there. So that's your challenge. I'd like to thank our guests, Julie, Grace, for being with us and sharing what they have. And in closing, I'd like to say, take courage, friends. The way is often hard, the path is never clear, and the stakes are very high. Take courage, for deep down there is another truth. You are not alone. Thank you for watching.